Hi everyone, welcome to our CCC Smiles whitening instructions. You are probably at a point where your teeth are looking a lot straighter and now it's time for you to whiten your teeth. So let's talk about how you're going to do whitening and we will help you go through the process. Before you do the whitening, you must know that you can use your aligner trays or your retainers or whatever tray you are currently wearing. If that fits your teeth, it's completely okay to use that tray with your whitening gels. And make sure you do not have any attachments or fillings on your front teeth in order for whitening to work. You will be given 2 whitening gels from us. As you can see that each gel will have a stopper and a mixing tip. You can also see a marking on this tube. So each mark is an indicator of how much gel you should put into your tray for each whitening application. Mostly you will be whitening your front teeth for both upper and lower arches. So make sure you put an appropriate amount of gel and you should never pass the mark per application for both upper and lower arches. Now let's go step by step on how you're going to do the whitening. So the first step is to brush and floss your teeth really well before starting, and also make sure your trays are clean as well. Now remove the stopper and put the mixing tip on. Make sure that whenever you're going to do the whitening, you put the mixing tip on, and whenever you're going to store your gels, you put the stopper on for that. Now let's talk about how you're going to load your tray. So after putting the mixing tip on, you're going to put a little tiny drop of gel onto the tray. It's very important that it is only a tiny little drop of gel on the wall of your aligner or retainer that faces the front of your teeth. Please do not put the gel into the middle or back of your tray. Just put the gel on the surface of the tray that is going to touch your front teeth. Then wear your tray and make sure it fits really well. Now you might notice a little seepage of gel around your gums. Grab a tissue and remove the excess gel in order to avoid sensitivity on the gums. We recommend each whitening application for about 20 to 30 minutes, once or twice a day. After wearing your trays for 20 to 30 minutes, remove them and rinse your mouth and trays both with cold water. Once you are done with your tube, put the stopper back and store it in a cool and dry place, most likely in a fridge. And make sure you do not freeze the gel and you put it away from children as it can be toxic for them. Now you can repeat this process once or twice a day for consecutive 7 to 10 days, depending on the sensitivity of your teeth. You can reduce your usage time and frequency according to that. Now, while you're doing the whitening, there are a few things to consider. So first of all, whitening gels will only whiten your natural teeth. Any crowns, fillings, or veneers will not be whitened. Any exposed root area due to the loss of gum will not be whitened. Your teeth and gums can become sensitive during the whitening process. So you can reduce your usage time and frequency of whitening according to that. And make sure you remove the excess gel from the gums as it can cause sensitivity on your gums. You can also use Sensodyne toothpaste either 2 weeks prior to the whitening, or you can start using it during the treatment. And even after that, if you're really finding the sensitivity hard, then you have to stop your whitening. And lastly, if you want your whitening to be really effective, we strongly recommend you to decrease the consumption of any food that is going to stain your teeth during the whitening process. Thank you for listening, guys. I really appreciate your time, and I hope this was helpful. Thank you. Bye.